Tell me a little bit about how you got to Mobile.
After I completed my formal education, I had a commitment to the Medical Corps of the United States Navy and was assigned, my family and I, during peacetime, my family and I were assigned to U.S. Naval Regional Medical Center in Okinawa, Japan. I had always aspired to a position in academia. And accordingly, as I was approaching the conclusion of my tour of duty, during a whirlwind trip, visited several institutions in the continental United States. I had to return to the continental United States as part of that recruitment effort. The University of California, Davis, University of North Dakota, Syracuse University, to name just a few. My mentor, where I was educated, at the University of Minnesota, recommended that I come and visit the program at the University of South Alabama, which had recently appointed Dr. P. William Carreri as the chairman. Dr. Carreri and my mentor had interacted both personally and professionally for a substantial period of time and strongly recommended that I come and consider the institution. So I traveled from Fargo, North Dakota in February, 20 degrees below Fahrenheit. They had to de-ice the plane, and traveled to Mobile, Alabama, which was my last stop before I returned to Okinawa, Japan. I stepped off the plane, 60 degrees, the azaleas, camellias were blooming, and I fell in love with it virtually immediately. I had the opportunity to interact with the founding president of the university, Frederick Palmer Whidden, and Dr. Carreri and his colleague, Dr. Ludeman. And I thought, at a relatively young institution, that I would be able to make a greater impact in terms of my professional development at this institution by comparison to the other institutions that I had visited.
So looking back 37 years later, do you think that came true?
Absolutely, categorically.
How so?
From a professional perspective, I had extraordinary latitude in terms of the clinical, investigative, educational issues that I aspired to pursue. There's a great deal of camaraderie and open-endedness in that regard. Now, that may be intimidating to some people. If you're not joining a department that has 9 people in your division, it can be intimidating. So you have to be, to a certain extent, you have to be maverick to be able to accept and participate in that configuration.
So do you consider yourself a maverick?
Hell yes! From day one.
From day one. So do you think that's something that you will continue in your retirement?
Oh, absolutely.
It's ingrained into you. Have you always been a maverick, and throughout your, not just A1 at the medical school, but as a developing young person?
As a young adult, yes. Not so much during my childhood and adolescence, but as I began to pursue higher education and became more independent from parental supervision, very much a maverick.
So do you associate the sort of cause and effect of the more educated you became, the more of a maverick or a builder? Or
I think the opportunities increased. as a consequence of my pursuit of higher education opportunities, both clinically and investigation.
So you mentioned your mentor as being influential in your career and development and getting started. And how does it feel to do that, basically do that for 37 years?
I think that is a commitment that is articulated in the Oath of Hippocrates. My generation is responsible for educating and nurturing our successors.
Mm-hmm.
That's been a philosophy my entire career.
Do you think that's changed from the time you took the oath to today, as far as the way that happens, or is it different? Or
No,
is it...
no, it's comparable. You must, both the student and the teacher must be committed to that endeavor. They must be open-minded and receptive to the dialogue that occurs. It is dialogic, because not only does the student progress professionally, perhaps even personally, but also the mentor.
Mm-hmm.
Critical, vital.
So I've heard words of people used to describe you as gentle but firm. Would you agree with those?
Concur.
Man of faith,
Oh, grounded.
Renaissance man.
Well, that's very gracious if they consider me that.
So I know you do. You're very talented in a lot of different ways. Was that helpful to you as far as balancing career?
Oh, indeed.
How so?
I think that's very important. A holistic approach to life, a holistic approach to patient care, a holistic approach to investigational endeavors, a holistic approach to educational endeavors. I think that's very vital. You know, it can be a challenge to achieve a balance in that regard, but I think they interrelate.
Mm-hmm.
And success in one endeavor does interrelate and interact with the other endeavors.
So there's a lot of talk now about being mindful.
Meditation and mindfulness, yes.
Was that sort of the same thing for you, that you would basically relax and
as much as I could. I was no saint. I was not in a monastery, but yes, that's very true.
So do you think?
And I think that's even more true now that I've retired.
Mm-hmm. Speaking of retirement, what are you doing with yourself now?
Well,
you're a very energetic man, so I'm sure you're not sitting around in a
First
hammock.
of all, you know, at this stage of my life, I think it was most appropriate that I retire. That I've been able to pursue other opportunities. So, poetry,
Mm-hmm.
pottery, online courses, great course company, studying the Latin language, the art of debate, philosophy, creative thinking. And I aspire to pursue education for ministry through the School of Theology, the University of the South in Swanee, Tennessee.
Is that a distance course, or are you traveling?
At the moment, it's a distance course.
Uh-huh. So it'll be blended, so you'll have some class time.
Correct.
That's great.
In Mobile, with a mentor serving as a guide during that course. It's very extensive. It's a 4-year curriculum.
It's quite a commitment.
And theoretically, you could apply some of that credit to formal ordination as in the diaconate,
Mm-hmm.
or formal education in the ministry. The dilemma in that regard is that it probably take me 9 years By then, I'll be 85 years old, for God's sake.
Be a very learned man at 85.
If I'm not dead.
The other thing that strikes me is that the true affection that people have for you. I think you're the only faculty member that I know that has a bobblehead. And people proudly display it, and I think that demonstrates that they're just that they appreciate the relationship and the encounters that they've had with you. Do you feel that, or?
Well, again, that's very gracious.
I don't want you to. I mean, I know you're a very humble person, but
very gracious.
Are you aware of it?
To share. But in that regard, one philosophy that I've adapted over the years is random acts of kindness, interpersonal relationship, to try to reduce the civil discord that exists contemporaneously.
So I know you were...
And that's the foundation of the Judeo-Christocentric tradition. And I would like to think I exemplify that.
That's great. So I know you've been awarded many times for your teaching. So can you talk a little bit about your teaching and your teaching style? I've seen you get people's attention at the beginning of lectures and things like that. So,
well, one of my fondest memories is to have appreciated the dynamic of the patient-physician, the student-teacher, the resident-teacher relationship, and to try to nurture those relationships. Occasionally serving as an agent provocateur in that regard to stimulate the individuals involved, to engage them in dialectical approach in terms of their professional and personal maturation. As they emerge as young physicians, as they emerge as surgeons. And I think that equally applies to the care of the patient. A holistic approach to patient care, body, mind, and spirit. And it was my privilege to serve in that role for patients in the University of South Alabama healthcare system. And many of those patients were indigent, disenfranchised, terrified, vulnerable.
I've heard you speak Latin in discussions. Did you teach yourself Latin, or did you take formal courses?
Mainly the former.
Mm-hmm.
Again, 65 to 70% of the English language is grounded in the Latin discourse. But I've been intellectually very stimulated by studying Latin. I must confess, to date, I haven't been involved in a formal credit course, but would aspire to do so at some point in time.
You fit that into your busy schedule, maybe.
Absolutely.
Also understand that you taught yourself Russian before you went overseas. Is that true?
Well, to a certain extent, we studied Japanese.
Mm-hmm.
And previously French and German.
Mm-hmm.
It was my son who studied Russian during his undergraduate years.
And I remember y'all went, was it a medical missionary trip to Russia? You and Dr. Lederman and Dr. Fletcher back?
Yeah, well, yes. Our goal, it was to provide a seminar in relationship to the introduction of laparoscopic technology to Rostov-on-Don, very remote community. Fascinating experience.
So what's the most...
And we literally transported the equipment to Rostov-on-Don from Moscow.
Wow.
And that was a unique experience. We had, it was a challenge to communicate. We were not fluent in the Russian language. We lectured in English, and a translator was involved. I interacted with the chairman of the Department of Anatomy at Rostov-on-Don for a brief period of time, and we communicated in Latin. I mean, that's the universal language for nomina anatomica. So it was a unique experience.
So I have gotten a couple of I call them purple notes. Can you tell me, well, let me tell you what I've heard, and then you can correct me. I'm probably going to be wrong. So what I've heard is that you enjoy reading a lot, and then, of course, reading when you want to give somebody an attaboy, you write a note and send a copy to them. Is that kind of the way it went, or
random acts of kindness?
Yeah.
To acknowledge what those individuals have contributed personally, professionally. I think that's very important.
So why the purple pen?
Regal. Purple is regal, royal.